Let's discuss the Chinese medical theory, Chinese versus Western medicine. The traditional Chinese medicine has been charged with being unscientific because of the theory on which it is based involves entities like Qi and meridians that appear ambiguous, and because the internal organs like the kidney and the spleen are understood very differently from those of modern anatomy and physiology. Furthermore, TCM methods of therapy based on the ancient principles of yin and yang and the five elements, as well as the classification of illness by constellations of symptoms known as TCM syndromes, are largely unproven by the clinical trial protocols of modern evidence-based medicine. Let's discuss the Chinese versus Western medicine. Chinese medicine refers to the system of medicine that has been practiced in China since ancient times. It is based on a body of theory that does not incorporate the scientific advances of Western medicine in modern times. In particular, the discoveries of microbiological agents like viruses and bacteria, as well as the enormous expansion in the understanding of human physiology and molecular biology since the advent of the scientific revolution in 7th century Europe. Chinese medicine practiced as an alternative to modern Western medicine in scientifically developed China and other East Asian countries is as much an anachronism as would be an ancient Greek and Galenic medicine were they to be practiced in Europe today. Yet in developed East Asian countries and some Western countries as well, it is indeed a serious alternative system taught in state-accredited university medical degree courses complete with graduate and research programs. Chinese medicine was practiced in China as a mainstream medicine well into the second half of the 20th century, following the large-scale introduction of Western science in the wake of the May 4th movement of 1919, the Chinese Enlightenment. Western medicine rapidly gained around over Chinese medicine in public health care. By the 1970s, there were more Western physicians than Chinese physicians. Nonetheless, even today, Chinese medicine continues to play a significant role in healthcare, particularly in rural areas of the country. Controversy over the validity of Chinese medical theory and the case for continuing state support for it was an inevitable consequence of the May 4th movement. Young nationalists, weary of the technological backward China that suffered repeated incursion into its territories by Western powers following the Opium Wars in the mid-19th century, viewed in the adoption of Western science and technology and democratic principles as the only way to revive the nation and restore its former glory. Young scholars returning from the universities in America, Europe, and Japan saw Chinese medicine as a relic of China's scientifically backward past and mounted a campaign to eradicate it and replace it with Western medicine. A public debate broke out in the 1920s when Yu Yan, who studied Western medicine in Japan, proposed the replacement of what he deemed unscientific Chinese medicine by Western medicine and the abolition of all Chinese medical practices other than the use of herbs whose alleged therapeutic properties would be subject to research by clinical trials. The robust response in Chinese medical fraternity, led initially by Yun Tikiao, set the stage for acronymous debates that raged for over 20 years. The conflict enjoyed a respite during the Civil War, followed by the ascendancy of Mao Zedong in the 1949 revolution. Mao, a believer in Chinese medicine but impressed also with the great advances made by Western science and medicine, declared Chinese medicine to be a treasure trove of Chinese wisdom, ordered its modernization and encouraged its integration with Western medicine. By edict, the training of doctors in Western medicine included courses in Chinese medicine. They were encouraged to use Chinese medicine in combination with Western methods, thereby lending a treasure of scientific legitimacy to the former. Some observers interpret this as part of Mao's political agenda to show that the Chinese also had technology and knowledge from which the West could equally learn. Thank you for your attention.